ਅਲਬਰਟ ਸਿਹਤ ਵਿਭਾਗ ਦੀ ਆਗੂ ਵਰਨਾ ਈਓ ਨੇ ਹਾਲਾਤਾਂ ਉੱਤੇ ਚਿੰਤਾ ਪ੍ਰਗਟਾਈ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਕੋਰੋਨਾ ਦੀ ਦੂਜੀ ਲਹਿਰ ਵਿਚਕਾਰ ਸਾਨੂੰ ਹੋਰ ਵੀ ਜਾਗਰੂਕ ਹੋਣਾ ਚਾਹੀਦਾ ਹੈ। ਉਹਨਾਂ ਭਰੋਸਾ ਦਿੱਤਾ ਹੈ ਕਿ ਵਾਇਰਸ ਤੋਂ ਬਚਣ ਲਈ ਮੋਬਾਈਲ ਯੂਨਿਟ ਤੇ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਵਧੇਰੇ ਬੈੱਡਾਂ ਦਾ ਪ੍ਰਬੰਧ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ।
And the pandemic continues to put enormous pressure and strain on all of us. I'm beyond proud of how each and every one of you have stepped up and continue to provide quality care to all of our patients, clients, and continuing care residents. You are all heroes. This afternoon, I want to talk about our contingency planning, which includes our mobile medical unit plan, as well as progress being made to increase our contact tracing teams. As part of our contingency planning, we have developed plans to create low acuity inpatient mobile medical units in both Calgary and Edmonton. While there is not a current need, it is clear that Alberta's healthcare system is under significant stress given the increasing numbers of COVID-19 cases in the province, and AHS must prepare for all scenarios. This plan is part of our ongoing, proactive pandemic response planning and is one of several initiatives that will ensure our healthcare system can meet increased demand caused by COVID-19. We are also trying to maintain a balance of continuing to provide non-COVID related care to Albertans. Throughout our response to the COVID-19 pandemic, AHS has proactively planned for all scenarios, ensured we have access to all resources available, both within and external to the organization. Additional beds in a mobile medical unit would be used for low acuity patients or vulnerable populations who need low acuity health care. These may be patients who are stable and on the road to recovery, but aren't quite ready to be discharged home. Having these mobile units would help reduce demand on our in-hospital acute care beds and teams. No formal agreements have been made. However, we are in discussions with several external organizations to identify potential partnerships. Staffing these mobile units will be a challenge, and planning work is underway on potential staffing models. And while promise of a vaccine is a light at the end of the tunnel, staffing remains to be a challenge, and we will continue to look at ways to deploy our staff. For example, in partnership with the College of Physicians and Surgeons of Alberta, we have relaunched the college's COVID-19 Physician Registry, which enables physicians to enter their current availability to provide care as part of our response to COVID-19, and their willingness to be contacted by AHS for COVID-19 redeployment opportunities if needed. This mirrors a very similar approach that we took in the spring. Provincially, there are approximately 8,800 out of 11,000 physicians who have responded to this request for redeployment. Physician redeployment will be based on service priorities determined through a consistent province-wide approach that reflects the needs of patients in each zone. This will assist AHS's efforts to support temporary staffing changes, which will ensure the availability of physicians in areas of greatest need.